From my perspective, a significant challenge affecting throughput in the emergency department is the limited number of available beds in the hospital. A large percentage of the time, the beds are occupied, leaving little room for incoming patients. How can we address this issue?
When you talk about bed capacity, you're right. I'm worried about this winter. Even over the last several months, there have been days that we've been 100% occupied. And we have 206 of our acute inpatient beds are located in the downtown hospital or in the Mineral King Wing. We have the Asequia Wing and the Mineral King Wing. The Asequia Wing opened in 2009, houses about 135 beds, fully seismically compliant beyond any deadline. The Mineral King Wing that opened in 1969, under current law, we cannot use those 206 beds for acute inpatient care past January 1, 2030. Although the governor just signed a bill called Assembly Bill 869 that gave a 3-year extension to small rural hospitals, critical access hospitals, and district hospitals. So it's a small population of hospitals, but we get a 3-year extension, which to me means nothing. Because to replace the 206 beds, we're estimating, and this estimate is from a couple of years ago, that it would cost $750 million to do that, without a penny of funding coming from the state or federal government. So it's literally left entirely up to the individual hospital and its community to come up with that $750 million to build that new hospital. We've even said that even without the seismic requirements, that those beds, those small pie-shaped rooms that opened in 1969, they're not big enough to accommodate the modern day technology and the number of people, the number of physicians and specialists that are taking care of those patients. We need to replace those beds anyway. If my preference would be that we find a way to be able to continue to use those 206 beds, but also be able to build a new patient tower to accommodate the growth of the future. So it's a conundrum. I was very disappointed this bill that did pass. The original version had a provision in it that said if a hospital can demonstrate that it does not have the ability to fund its replacement project on its own, then it would be indefinitely exempt from the 2030 deadline until such time as the state provided the hospital with the funding to do its project. The governor stripped that completely out of the bill and just left it as a 3-year extension.